Practical Medicine Podcast, and we are Dr. Rob Balko.
And Dr. Stephanie Lipnicki.
And it is our goal to bring awareness to the public at large about the many different ways to maintain health and heal your body, mind, and spirit, from acupuncture to Zen living and everything in between. The topic this week is acupuncture and endometriosis. And we have a very special guest here, Stephanie Lipnicki, who is going to tell us all about it. Let's start at the beginning. What is endometriosis?
So the current definition of it that's the most accurate is that it is endometrial-like tissue that grows outside of the uterus in various areas of the body. However, if you use the Google to look it up, there are still outdated definitions that refer to it as the endometrial lining, but it's not. It's described as being similar to it, but the tissue is not the same. And the theories of what causes it are different than they were, say, 20 years ago. So
what happens to the tissue? What is the mechanism?
It responds to hormones, and it gets it's scarring, and it gets it can get dark and chocolatey. They call them like chocolate-like cysts. Mm-hmm. Sometimes they're described as looking like cigarette burns on the abdominal cavity in various areas, and it can attach to the uterus, the outside of the uterus. It can attach to the bladder. It can attach to the intestines. It has been found in the lungs, not as common, but it has been found in the lungs. Ovaries, it can collapse the fallopian tubes because it encases it. And more recent studies have shown that it has even been found in the brain.
In the brain?
Yeah.
Wow.
It's there, and that's, newer information is coming forward with that.
Amazing.
Yeah.
Can men have endometriosis?
They can, and it's not just transgender men. There are 20 known cases of men having endometriosis, which I'm only going to guess is even harder to have diagnosed because it's fairly hard for women to even get that diagnosis, even today. Like, I was diagnosed 20 years ago and it was hard. It is, still, people report an average of 6 years from the onset of symptoms and being diagnosed. So once you have symptoms, you've already had this for a period of time.
Right. And how prevalent is it?
1 in 10 is the
Wow.
number that we all, so March being Endometriosis Awareness Month, if you're on social media at all, you'll see a lot of people posting that they are 1 in 10, which equates to 176 million worldwide being impacted by it. So it's a lot of people. And that's, and then like my mind goes to the place of that's the number of people that we know of. The numbers could be higher than that.
Yeah, I would think, I would think in more rural areas, there's not a lot of medical care in the first place, let alone specific OBGYN type of care.
Right. And like we talked about in the GYN episode, when you and I were talking about when patients come to us and, you ask them about pain and they tell you that they have the normal amount of pain, but, there is no normal amount of pain. And I think that a lot of people with endo start to end up having a higher pain tolerance because, it is so. They say it's, one of the top, I think, 15 or 20 most painful diseases that there are. So it's up there in terms of, how painful and how bad it is.
So how do you determine if you have endo or not?
So the gold standard is laparoscopic surgery, where they go in and they do usually 3 small incisions in the abdomen, and they go in with a camera and they start to look around. Optimally, the person who's doing it, if they're, at that time, they'll do what they call excision surgery and start to try and remove some of that scar tissue. There are some tests that it can show up on. Like for me, they, prior to doing the surgery to make sure that that was what it was, I had a CAT scan like in the month prior to the surgery to see what they were dealing with. I finally found a doctor to listen to me. And on the CAT scan, before she went in, she said, this is either cancer because my entire left side was so enlarged. It gave the impression that my left ovary was like 8 times the normal size, but that was all the scar tissue around it. And it ended up, she tried to save it, but it ended up needing to be removed. So my laparoscopy to discover if that's what I had turned into a laparotomy, which is where they make the same incision that they do when they perform a C-section on someone who's having a baby.
Wow.
So it was like a 5-hour procedure. And usually a laparoscopic procedure is, fairly quick, taking time, if someone has more mild. So, I mean, I understand doctors' hesitance to want to put someone under the knife and under anesthesia, but it really is important to determine if that's what it is. Like for me, it was stage 4 by the time I got someone to open me up, whereas if they had opened me up and looked when I was begging someone to take a look, it might not have progressed to that. And that my doctor admitted that she knew how badly I wanted children. She would have done a hysterectomy if it wasn't for the relationship I had with her and how bad she knew I wanted kids.
Right. So how far into it were you, like you said, if they had listened to you?
So
when was that? Was that?
Okay, so you talk about people saying normal versus not normal. So my onset of menstruation was at 12, and I was sick from day 1. My mother told me that when she threw out the mattress that I had as a teen, she was embarrassed to put it to the curb because it looked like someone was murdered on it. So abnormal amounts of bleeding. I had nausea and vomiting. There were lots of days that my dad or my mom picked me up from school because I couldn't even make it through the day. I would be balled over in pain. And I think at one point, so I was still with a pediatrician at the time. It wasn't a GYN. They gave me Anaprox, which is it was a pain medication at the time. I don't know how common it is now. And one of the side effects of that is it induces vomiting. So why would you give that to someone who's already vomiting? Like, yeah, you're not throwing up enough. We're going to make you throw up even more. So my surgery was in 2001, and I was 28 at the time. So that's 16 years. And the first time that I realized that it was probably endometriosis was in the early years of me being a massage therapist. I was massaging someone, and that was why she was getting massaged, because she was in all of this pain. And as she talked to me about it, I thought, I think that this is what I have. Like I was, ticking off all the boxes. So you figure maybe like 1992, 1993. And I had already had 1 ovarian cyst, so I must have been with a GYN at the time. And their response was, you're too young to have it. But, if at 18, 19, they had listened to me, steps could have been taken earlier, both Western and, I started really intensely with the acupuncture stuff probably when I was 25, receiving acupuncture, and taking herbs on a regular basis. So, I can only imagine that that's probably one of the reasons it saved me from having to have the hysterectomy at the time. I recovered fairly quickly from that surgery. And there were times, so probably when I had my twins, I kind of was lax in the care because I was taking care of twins and not getting acupuncture as regularly. So between having them and then when I had Rihanna, who's 2.5 years younger, when I had her C-section, they had to clean me out again. So that's like from 2001 to 2005.
So the endometriosis came back.
Yeah, yeah.
It had grown, spread.
Yeah, I think that what happens is when they do the surgeries, they're clearing out what they can see. But sometimes there are smaller lesions that are like maybe in the beginning and they're not as noticeable. They try and get out, the stuff that's more noticeable, and then they don't. But then between 2005, having her, and when I had all my health issues, because what goes along with it a lot of times is that you can have fibroids and adenomyosis. So I had a hysterectomy in 2017 after hemorrhaging. And I was able to manage it from 2005 when I had Rihanna to 2017 with acupuncture herbs and a combination of Western treatments. So I did both.
So it's very easy to be misdiagnosed.
Yes.
And it's very easy to have a medical professional not have enough information
Right.
to make that diagnosis.
Right.
So that's why it's important for advocacy, and,
Right.
doing what we're doing tonight,
Right.
to educate people to ask more questions, that it's not
Right.
normal to be doubled over in pain when
Right.
you're 12 or 16 or 30.
Right. At any age. Yeah.
Right. So what are some of the symptoms?
So
Let's-
apart from the excruciating pain when someone's cycle, starts, they can have pain throughout the cycle. They could have it in the middle. They can have it continuously. It can be the abdomen. It can be the lower back. It can descend down the legs. If it's someone who does have it in their lungs, they're going to have some shortness of breath and trouble breathing. They can have headaches going with it, nausea, vomiting. There's a lot of GI symptoms that go along with it. So sometimes people will think that they also have irritable bowel syndrome, but it's actually the endometriosis. So they can have that alternating constipation and diarrhea, and it's painful when they go to the bathroom. They can have trouble with urination, be prone to urinary tract infections because of it. A lot of times they'll have more urinary tract infections that go along with intercourse because of where the lesions are on the bladder. Painful when they're having sex, to the extent that some people report that the spasms that can happen in the uterus that go along with reaching orgasm can continue on for days and have a whole pain cascade associated with that. And then they can have irregular bleeding. Anxiety and depression can go along with it because you're anxious that, am I going to bleed through clothing? Am I going to be in pain? Am I going to have a good day? Am I not going to have a good day?
Right. Will I be able to enjoy this weekend coming up away
Right.
or a vacation or
Yeah.
something like that?
It's hard to make plans just even like the next day sometimes. And like a vacation, I don't think I ever really planned a big vacation. It seemed unreachable because you just don't know what's going to happen. And then the bleeding is usually more heavy. There's clotting with it. Sometimes that pain passes a little bit, but most of the people who have it will tell you that they're doubled over in pain, missing days of work, missing days of school. And then not all the time, but it is common for there to be fertility issues that go along with it.
Right. I've had a couple of patients who have had that procedure done that you're talking about.
Yeah.
To I guess remove what's possible.
Right.
In the hopes that before it grows back,
Right.
they will get pregnant.
Right.
Yeah.
Well, that was one of the things that they had told me. So I had 3 miscarriages before that surgery. And the way it was explained to me was that there was so much scar tissue that it was like the uterus couldn't get bigger. And that's why I wasn't making it past 10 to 12 weeks before it wouldn't progress any further. That combined with the fact that the tissue does respond a lot to estrogen. So my progesterone levels weren't where they should be, and the progesterone is the hormone that maintains the second half of the cycle. It was always super, super low. And, and that's not even like one of those things that you could say happens to everyone. There are some people who have endometriosis and don't have estrogen dominance. So that's one of the things that's crazy about this disease is that which makes sense in our medicine, because no two people are alike, but mine could be this way and someone else's could be totally different. So, and I feel sometimes like Western medicine has these cookie cutter components of treatment that ours is less cookie cutter.
Speaking of cookies, let's talk a little about that. What are the Western approaches?
So after the surgery, once they've diagnosed you, and sometimes without, like I had a doctor tell me that they were just going to treat me like I had it because that was good enough. Mm-hmm. So that's often birth control pills. Sometimes they'll do a more...
And why birth control pills?
Because it's supposed to lower the estrogen level.
Okay.
Even if you're using it, supposedly if you're using even an estrogen-based birth control pill, because of the way it binds to receptors, it's not as high as your own body would be. But it's a chemical cycle. It's not a real cycle.
Right.
And it doesn't help with everyone. You know, there are some people who say it didn't work for them. Like they've tried it and it just, and again, that goes into everyone's body is different. What works for me might not work for the next person. Lupron is another drug. It kind of is supposed to mimic sort of a short period of menopause. So it kind of stops the cycle. I did two rounds of Lupron that were piggybacked with birth control pills right before 2017 when I had all that stuff go wrong. And I thought Lupron at that time, I was like, if you could give me this the rest of my life and do this with acupuncture, I thought I would be good. But they'll usually only give it to you for a couple of cycles. I just, it's so intense. And yet I have a good friend who tried it. She had, endometriosis as bad as me. She said she felt that Lupron made her go crazy.
Mm-hmm.
It just, like, she felt like it caused rage for her. It just wasn't a good fit.
Well, in our medicine, when you take something like, let's say, you take something, right? In this case, it's Lupron or a birth control pill, and you have an adverse reaction, that means the diagnosis is wrong.
Right.
Right?
Yeah.
So in your case, Lupron matched your diagnosis.
Right.
And I guess it's really way too strong to take for any long period of time.
I don't know if it's a side effect issue. I just remember they were like adamant that you can't really. And it's different from when someone undergoes IVF, they administer the Lupron in a different way to control the cycle before they're going to do transfers and things like that, or retrievals and that sort of thing. But it's not the same dose as they give you when they're trying to stop the cycle. And in our medicine, we talk about that not being a good thing, that there's this sort of detox when you're getting rid of the blood. So it's causing a stagnation in a different way, or the stoppage of energy, the stoppage of movement.
Right.
So
I think of that as an example, meeting yang with yang rather than trying to manage yang by introducing more yin.
Right.
Is, what do you do with a hot person? You cool them down. You don't add more heat.
You're right.
And that's kind of what we're talking here. Is like
but then if it doesn't work, you do add more heat. It's kind of playing around with it.
Ultimate yang will become yin.
Yeah. And then NSAIDs or prescription drugs are another thing that, so the non-steroidal anti-inflammatories, to me, it's another Band-Aid. It's not actually, it's dealing with the pain part of it, and sometimes you just got to do it. But that doesn't treat endometriosis. It treats the pain component of endometriosis. So, and there is no known cure right now. There's no known cause. There's speculation of different things, but there's no known cause and no known cure for it.
Who is the main doctor that would work with you with this? Would it be a reproductive endocrinologist?
It could be. I mean, I always tell people you want someone who says that but someone who's telling you that they specialize in it.
I guess the question I'm really asking is who's trying to discover or determine the source of this.
I don't know who's doing
cellular problem.
I mean, I would think a reproductive endocrinologist would be involved in the studies of it, but in terms of who someone wants to see, somebody who,
Sure.
not just your average GYN, which again, when you talk about living somewhere like we're located in the tri-state area, and I feel like we have access to specialists for just about anything under the sun. If you're living in a state where the nearest hospital is 30 miles away, are you going to have somebody who specializes in endometriosis? Probably not, because even though 1 in 10 is suffering from it, how many of the population there are suffering from it? So you need to really be willing to seek out, a qualified practitioner.
So it seems like these approaches are sort of just suggestions almost. I'm not trying to put it down, but it's like, well, let's give you some birth control. Let's see what that does.
Yes.
I just had a patient recently who had a copper IUD inserted, and
Right.
it created so many more problems
Right.
than it was solving, and
Right.
it came back out, and now they're doing something else, and
Yeah.
and some of it is trial and error, it
Right.
seems, and like you said, the Lupron worked for you,
Right.
didn't work for your friend.
Right. And sometimes an IUD can work for someone and not work for someone else. There are different types of using forms of birth control to help with some of that endometriosis stuff. But again, some people feel like it increases their bleeding where the IUD is not supposed to increase bleeding for sure. Our medicine has some of that, trying to really fine tune the person that's in front of you. But I feel like, and there are a lot of different birth control pills and different doses. But, where they used to tell you that was a cure, it is not a cure at all. It does not cure it. There's, a whole list of things that.
Well, we're managing symptoms.
Yes.
Right?
Yes.
Is, what is the problem? And usually that's the list that we were talking about above that, right?
Right.
It's heavy bleeding, pain, headaches, right? Nausea, vomiting. Those are symptoms of a deeper problem.
Right.
And that's where the integrated approach comes in.
Right.
Right? Is your specialty, along with a number of other people, which we'll get to, to discuss, that people need that, like I said last week, the pit crew.
Yes.
Right.
Yes. And I was trying to think of what we were saying because I was like, oh my gosh.
Right.
I was doing something during the week and I was like, Rob had the best analogy and I couldn't remember what it was. That's what it was.
And
Your
I really
pit crew.
owe it to a couple of my patients independently told me, they said, you're now part of my pit crew because they've moved to this area from New York City and they have a massage therapist, an OBGYN, a physical therapist because they were in a car accident or something like that,
Yes.
et cetera, a chiropractor.
Right.
And they make the rounds.
Right.
To these people.
Right. And we are going to actually talk about that with this too, but I just wanted to talk about some of the misconceptions because with it being Endometriosis Awareness Month and being on social media, seeing some of the things that are still perpetuated that aren't true. And, if you're new to it, I feel like it's so damaging that someone is still telling you that this is what it is. And like we were talking about when we were prepping content, that when you ask, and as I always say, when you ask the Google, that there's still a lot of misinformation out there.
And I did just that.
Right.
Let me look up what is
Yes,
endometriosis. And it said exactly what you said was false.
Right. Okay, so that's the first one. That back when I was diagnosed, so again, this is 2001, which now feels like a long time ago, but somewhat not that long ago, they talked about it being retrograde menstruation. That when someone menstruated, that the blood went back flowed through the fallopian tubes and out into the abdominal cavity, which would be all fine and dandy, except for the fact that that doesn't explain how it attaches to why is it showing up in the lungs and why are there all these other places? And that, at that time they thought it was the same tissue that was, shed during menstrual bleeding, and it's actually not the same tissue. Again, that you can't get it before a certain age. If I had symptoms at 12, I clearly had it at a young age. I remember them telling me, well, if when you just not the doctor who finally did my surgery, but the doctors who were telling me, well, even if that was what it was, as long as you get pregnant and have kids young, that's a cure. Pregnancy isn't a cure. It generally stops the symptoms while you're pregnant and while you're nursing and you don't start menstruating again. But then once you start menstruating again, you have those symptoms again. Menopause is also not a cure. For some people it is. Sometimes they get, sometimes some things get better, but it is not considered a cure. It's, particularly like in a case like mine where they leave your ovary in and it's still producing hormones, definitely not. The stage of endometriosis that someone has is not indicative of their level of pain. So someone with stage 1 could be doubled over, and someone, believe it or not, with stage 4 may not even know they have it until they go to get pregnant and are having fertility issues. So thinking that just because someone tells you that they have stage 1 endo, that it's mild, it might not be mild for them. It could be excruciating. And there's no rhyme or reason to why that is, but you don't, as a practitioner for me, I'm not going to dismiss someone and think, well, you have stage 1, so you couldn't be that bad. It's not. That's not the, not the defining thing. That it's just a uterine disease, because it's not. It's a whole body disease. There's a lot of stuff that feels like crap when you have it. Hysterectomy is not a cure. Again, that the stage does not determine the level of pain, and to remember that the tissue is not the same tissue as the endometrial lining. It is like it, but it is not the same. Should we talk about the pit crew?
Let's talk about the pit crew. One thing I wanted to say to finish up a thought on that was, you're talking about how these, pregnancy or delivery or menopause is not a cure, but what it does is some of the symptoms go away.
Right.
Maybe.
Depending
on the person. Right. And your point about being stage 4 and feeling nothing, or being stage 1, reminds me of the studies they've done on bulging discs in the back, right? And what they did was they gave 100 scans to doctors, and they told them, diagnose this person, give us their story. And they would say, well, this person must obviously be in a 10 out of 10 pain, and this person's not in pain. And it was just
Same
like what
thing.
you're describing is, you can have bulging discs and collapsed discs and not even notice.
Right.
And be running foot races, marathons, whatever. Or you could have the slightest bulge and be on disability and not be able to do anything.
That makes sense. I mean...
So another, again, why what we do, I think, is so helpful to people, is we approach the person where they
Meet them where they are, yeah.
And we talk about what they're experiencing.
Right.
And then we measure progress from that point. That's our baseline now.
Yeah,
right?
Absolutely.
So, let's talk about the pit crew.
Okay, so I think that, and I haven't used this myself, but a PT who specializes in pelvic floor treatments, and I think it's more common now. And personally, I'm actually considering it because the last surgery that I had a lot of things go wrong, and my bladder and one of my ureters was torn. So they sent me home with a stent, and on the side where the stent was, and the stent comes out 30 days after the surgery, but I have the range of motion in that hip is now less. And that was the hip that had more range of motion before. So, and there's a lot of different reasons that PT can help, because it helps to stabilize the pelvic girdle. There's a lot going on, and a lot that, when you're recovering from surgery. So having a PT, and the PT specializing in that, I think is important. Chiropractor. Like I said, there's a lot of back pain that goes with it. I always feel like I can only go so long without seeing my chiropractor. I think that when the swelling happens, there's a lot of swelling, this situation that they call endobelly, where you get asked a lot, oh, are you having a baby? And it's like, no, just having a fat day, just having a nice big endobelly day. But that, that can throw the lower back off. Sure. So having a really good chiropractor, my personal chiropractor does a lot of kinesiology and muscle testing. So she'll tell me what groups are not working well, and, stuff to massage on my own when I go home. So that's super helpful.
And I think that's the mark of a great practitioner, is someone who's educating you along the way and giving you things to take home and do.
Right.
Today I gave someone a book on, hot, cold, damp, dry, dieting, food choices. Yeah.
It's funny because she'll say to me, and I've learned my lesson, when I go and buy new shoes, she'll test and tell me whether they're, and I've tried to test the waters at home, because I'm always like, does that really work? And sure enough, the shoes that she tells me are bad, if I wear them at work, by the end of the day, I'm like, oh, why did I do that? My back now hurts. So, a psychiatrist or psychologist, there's a lot of emotional strain that goes with it. And I just feel like having someone outside of your family to talk to is a huge benefit. And I mean, sometimes like with COVID, I haven't gone to my therapist because I like the face-to-face, and I know a lot of therapists are doing virtual visits.
Right.
And if you feel like you need that virtual visit, by all means, don't hesitate because you can't go in person. Yeah. But I know that she's there if it gets really overwhelming for me and I need her. And that person doesn't have to specialize in endometriosis, but definitely someone that you're comfortable talking to.
Right, right.
So
I was on a Zoom call this morning, and we were talking about almost the evolution of online communications.
Right.
And how one thing I'm learning from my school teachers is that some of the special needs kids are actually thriving now.
Right.
Because they have this, they're separated from the distractions.
The distractions.
And they're actually, once they got over the hump of the first spring.
Right.
Right. The last March, April, May, that was rough.
Yeah.
But when the school started again, they were really excelling.
Right. That makes sense.
And that, professionals are getting really used to this now. There are a lot of missteps in the beginning and confusion and stuff like that.
Yeah.
And I agree with you. Nothing beats in person.
But that's one of the things that I have a therapist who rents space in my office, and he and I were talking about he was glad that they extended the virtual, only because as much as he wanted people back in the office, he was saying that with the mask on, he felt that there might be a little bit more of the ability to try and hide your emotions. Even though you can see it in someone's eyes, he was a little concerned about that. So, I could see where, at least on the computer, you could still see the full range of emotions with, not having the mask on.
Right. Good point.
Good friends and family that are understanding and supportive. It may take them a while. I sometimes still feel my own mom doesn't understand. And, you're talking about that I've had this for years.
And I think a big part of that happens with so many people with so many different conditions.
Right.
Where you can't see the problem and you're functioning every day. So how could you be sick?
Right.
They lose sight of what's going on for you on the inside.
Yeah. And you get very good at hiding it. My back went out because I was eating a lot of the wrong foods, and I had a big flare up at Christmas time. And this was the first time that I realized that rather than struggle, I used a cane. But you know what I did? I hid it behind my desk at the office and slowly held the wall because I didn't want my patients to see that I'm, was struggling. Right. So we do get really good at hiding it. And it's an inside disease. It's not like I wear this scar tissue on the outside that people are like, oh, I can see that you have something wrong.
Right.
So, and I've lost friends over it that didn't, just didn't want to hear about it. And it's it's hard, I don't know how you can expect someone who's living with a chronic illness to just, not have it be, it's just there. Not that you're talking about it all the time, but it's a part of your life and it's going to come up.
And sometimes a very big part of your life.
Right. Yeah.
I've had some patients confide in me. They were at the end of their rope. And they thought they were considering suicide.
Wow.
Because they were in so much pain.
Yeah.
And everybody they had been to could not help them.
Right.
And they didn't want to be out in public because it's no fun.
Right.
It's no fun to be around people who are laughing and enjoying themselves when you are in
when you're in pain.
Terrible pain.
Yeah. And like I said, a GYN who specializes in endometriosis, and like you said, a reproductive endocrinologist, particularly if there's, you want to have children. And that goes back to the psychiatrist, psychotherapist, psychologist. If that it happens that someone can't have a child, I feel like having somebody to talk that through, especially for people who, it never occurred to them that it would be a problem trying to conceive. And we'll do, I'm sure down the road we'll do episodes focused specifically on fertility and infertility, but having those. And then that's where we come in. I kept us as the last part of the pit crew because I wanted to talk a little bit more about, we were saying that, we're looking at each individual. So it's not like 6 people who come in with endometriosis or gynecological problems are all going to have the same main concerns. I feel like pain is always going to be a part of it, but somebody might be pain and fatigue. Somebody might be pain and gastrointestinal distress. Someone else might be, abdominal pain and headaches. Someone might be abdominal pain, low back pain. I'm not going to treat them all the same. There may be some underlying things and advice that I'm going to give to all of them, but their treatments are not going to look like, I stamped out little endometriosis cookie cutters and that they're all getting the same thing.
And they all may have a different emotional reaction.
Right.
Some may be anger, some may be sadness,
Frustration,
anxiety.
I think a lot of times you feel like I felt broken. I felt like I was, particularly when I, knew that I was having fertility issues going along with it. I felt like I was broken. This was something, I always wanted. And, you want that practitioner to be nurturing and supportive to help you on that journey. I always say that I want my patients to feel like they don't have to walk this path alone, not just with endo, but anything that they come in for. I want them to feel like they're supported and that we're listening. And it goes back to what you said in the beginning. How long are you spending in your practitioner's office, and how much of it is with the practitioner and how much of it is waiting in the waiting room? So, we talked about that. Most people spend 45 minutes in our office, and of that, 30 of it is needle retention and 15 to 20 is us chatting with them and checking in.
Right. And them being by themselves.
Right.
Relaxing. Right. Resting.
Yeah, but not anxious in the waiting room waiting for us, relaxing with the needles in and getting a treatment. Right. So my goals with acupuncture and herbs are to hopefully preserve fertility if that's something that they want, reduce the amount of time between their surgeries, help them to prepare for the surgeries. Getting acupuncture before any surgery is a great thing you can do for yourself. You will heal so much faster. And then recovery afterwards, pain management throughout. Again, looking at the individual in front of us, figuring out what factors make it and patterns make it worse. Like most of the time, having heat on the abdomen feels better. Sometimes you might have to have, and this is me, I'll have something hot on my abdomen, but something cool on my lower back because there's so much inflammation in my lower back. And that balance of like, I've got the yin and yang at the same time, the heat and the cool. And in our medicine, we talked about this with the multiple sclerosis topic, it's generally considered blood stagnation. There might be some phlegm component also, and the herbs are working to break that up. So it's sort of moving but nourishing at the same time because there can also be a component of being anemic with it. And being blood deficient, which you think, well, how can you be blood deficient when there's all this, blood stagnating elsewhere? But that's the beauty of a lot of our herbs is that they can be moving, but also super nourishing at the same time and work both ways. When I first went through my first surgery, really the only things that I found in terms of studies, and I was at PCOM studying acupuncture at the time, were related more to fertility. But when I did the doctorate component, there's actually studies now showing that acupuncture lowers the CA-125, which is, it's a cancer marker that they can, with people with endometriosis, it often can come back higher. Doesn't mean that they have cancer. It just, it is a cancer marker, but they can run this test and it's often high. That acupuncture lowers that. So we're reducing the pain and working towards healing. NSAIDs and the pain drugs don't do that. They're not lowering that marker. So, and it's been shown that the acupuncture is just as effective as those pain meds in terms of the pain component of it, which I think is so great that we can now back up what we already knew with, because people want that. They want to see, well, okay, so you're telling me this, but they want that, I feel like, especially in America, we want that scientific backing for any, I want to see the proof that it's, that there are studies on it. So yeah, I mean, there's so much that, we can help with, but I will say that the one thing that I feel like people should know is that they need to be patient with it. I mean, I always say this no matter what happens when somebody walks in the door. If I was so magical, and I am quite magical, that I could make somebody better in one visit, I would charge a lot of money and I would go on a lot of vacations. I feel like with any gynecological issue, and especially with endometriosis, because again, when you're looking at it taking an average of 6 to 7 years to being diagnosed, 6 to 7 years, and you've already had it when you're showing symptoms, that it could take 3 months to 1 year to get it stabilized. Now, that doesn't mean you're in pain that whole time. It may mean that, okay, so you have to do the birth control pills for a little while at the beginning, but then you can get off of them and just be doing the acupuncture towards the end of it. And usually it's more like 3 to 6 months of that's the most drastic change. And then that last 6 to 12 months of working with someone is just getting them on a maintenance plan and they're stable at that point. So, it's nice to see that transition. I like working with someone through that long haul so that they go from missing work or missing school or missing out on life and being able to experience life again, which is not to say that every once in a while you don't do stupid things like I do and eat too much sugar and make your back go out and have a big flare up.
But you get the feedback and then you adjust.
And I'm like, okay, stop being bad, stop misbehaving.
It still works that way.
Yes. I think there's a part of me that wants to be this girl who could, like I always am, like a fat girl in a candy store. This is why I'm as big as I am, because I'm just like, give me all the candy. Just give it to me all. And my body is like, no, you're not that person. I mean, it's not really good for anybody, but especially when you have anything that's inflammatory, sugar just makes it that much worse.
So what are some foods that should be avoided?
So the big ones are to try and avoid wheat and gluten, which is not to say that it means that you have celiac. It's very inflammatory and it seems to trigger a lot of people with endometriosis. Dairy. Some people are okay with red meat. Some people are not okay with red meat. I tend to feel better when I have red meat in my diet than when I don't have red meat in my diet. I'm okay with cheese. I'm not okay with milk. I get sick from like milk. And I definitely, for me, like wheat is the root of all evil.
I have a theory on that.
Foods that...
In that it's inflammatory, especially to the colon. And where is the colon?
Right near the uterus. And where are some of the adhesions?
Right. And it's near the sacrum.
Right.
And the lumbar spine.
Right.
So after a weekend of indulging holiday meals, right?
Yes.
Christmas time, people have low back pain, inflammation, right?
All that stuff. Yeah, even if you don't have a super inflammatory condition, just in general. Right. I follow the FODMAP diet, which is you try and avoid foods that are high in fructose oligosaccharides. They call it the IBS diet. It's a lot of like, you want to avoid the foods that are more inflammatory, like the, foods that are too high in sugar, even naturally. Certain pit fruits tend to be a little bit higher. Avoiding alcohol. I know for me, 1 or 2 drinks and then I'm done. And it has to be like far apart. I could never be someone who had drinks like every weekend. It just doesn't do me, and I don't feel good afterwards. I feel bad for like 2 days later. So probably also that comes from the fact that I like sweeter drinks when I am going to drink. So that goes back to the sugar. Avoiding alcohol, artificial trans fats. I remember reading years ago that like microwave popcorn is really high in trans fats that are not healthy for you. So like it's better to just make your own. And what's fun about making your own popcorn is then you can put your own spices and stuff in it. It's just, we have our own little popcorn maker at home and
What are your favorite spices to put on popcorn?
So for a while, Wegmans had this oil that had like seasoning. I think they still have it. I got a free bottle, so that's probably why I was using it. And I think it had like rosemary, garlic, thyme.
Oh, wow.
And I used that as the oil in the popcorn maker and then a little bit of salt with it. It was so yummy. And like I said, figuring out what meats. And for some people, it might be doing an elimination diet and stopping a particular food for a couple weeks and then
introducing it and seeing the
introducing
reaction
it
'cause
back. Yeah.
very
Yep.
good. What other things can people do at home?
So the hot water bottle is your best friend. I use a lot of microwavables. So I have these like microwavable plushies, and I've had them for years. I have 2 sheep and I have a unicorn. So I just put them in the microwave for like a minute and a half, shake them up, put them in for another minute. The reason I prefer the hot water bottle or a microwavable is because if someone is on pain medication and they fall asleep with the heating pad on, there's a tendency to burn the skin. And I've seen a lot of, particularly on social media, where people with endo have ended up with like some nasty burns on their skin. So rather than that, I tell my patients to use these microwavables because even if you fall asleep, it's going to cool off. It's not going to keep getting hot.
And you do want it to cool off. You don't want that continuous heat
Right.
for hours. It's
Right.
really not good. For
Even
you.
if you do like, if you feel like you need it to be continuous, doing like 20 minutes on and 20 minutes off, or like half hour on, half hour off, so that it's not all the time. I think topical CBD is a great thing, which I didn't have when I was younger, but I find that it helps now, both with the abdominal pain and with the lower back pain. And I use, a colleague of ours makes that evil bone water. Sometimes I'll spray that on my stomach and then mix that with the CBD and then put, a lot of people take internal CBD now. In terms of specific vitamins, I feel like that's something that I have to go through on a case-by-case basis with patients, but a lot of times it's, an anti-inflammatory that has turmeric in it, but not always. It's all going to depend on the patient. Definitely a good multivitamin. I wouldn't want to say, okay, this is what I take and say that that's going to cookie cutter be the perfect thing for everybody, because it's not necessarily. So yeah, those are the ins and outs, and I feel like this is where our medicine shines, because we can, look at each individual in front of us. So, do we have any questions?
Looks like we have a couple. Is Aleve Anaprox?
That I'm not sure. I thought Aleve was more like ibuprofen.
It
Is it Anaprox?
They are the same.
Okay.
I was going to say no, but then I looked it up.
Okay.
It's a non-steroidal anti-inflammatory.
Yeah, see, back when I had it, it was prescription, so that makes sense that it would be over the counter by now, because I'm old. Yeah, because that's 30 years ago that it was prescription, because I was in high school, I think. Any other?
It's very similar to ibuprofen, but they are not the same.
Okay. And like I said, one of the side effects of it, and maybe this isn't anymore because over the counter sometimes changes it, but it definitely, I remember reading that I was like, why am I throwing up more? And it was, it induced vomiting.
There was a question about foods to avoid, which was answered.
Yeah.
Does yoga, stretching, or Tai Chi help, or is that more for cramps and back spasms?
I definitely think more gentle exercise helps. I mean, I don't think I could ever consider running. I just, the thought of it and the pounding, and I think my uterus would be like, what are you, well, not now because I don't have one, but at the time my uterus would have been like, what the hell are you doing to me? Which is not to say that there aren't endo warriors who are runners, but I think Tai Chi and yoga and stretching, because there's that relaxing component, to me, those are the ideal things that I would tell people to try at home.
Do you need extra iron because of the blood loss?
I do think some people do. Although I don't necessarily do it
deep.
with the iron. I do it with formulas that are blood building, because sometimes they're a little more gentle. But it's something to definitely have patients stay on top of. Some people do tend to have very low iron, and some people don't. I mean, the last time I went in, they were like, with that whole fiasco that happened to me, I went in and it was like the first day I was hemorrhaging, and they were like, oh, you're not anemic. And I was like, of course not. I've only been bleeding for one day. Like, really, I'd have bigger issues but that is a common thing. Yeah. I know that there were a lot of times that my mother found me passed out Like I had gone into the bathroom, I got up to wash my hands, and she would find me on the bathroom floor. So definitely there can, because of the blood loss. But that's, again, why I like the Chinese herbs, because they're moving and nourishing at the same time.
Very good. I think that's it for questions.
That's it for our questions.
Comments.
Are we good? Should we do our closing announcements?
Mm-hmm.
Okay, so next week on March 15th. Oh, yeah, I should apologize for my social media posts. So I somehow, on my own episode that I'm starring in, managed to put that it was February 8th. So I just want to clarify that we do not have a DeLorean. We did not travel back in time to record this episode. It is being recorded live today on March 8th. Rob caught that at the last second, and I tried to change it.
Sort of like a Logan's Run kind of thing.
It was very Logan's Run, wasn't it? It was so Logan's Run. So on March 15th, we have Juliet Ayana will come on to talk about eczema and treating it with acupuncture and herbs. On the 22nd, for episode 18, Dr. Martha Lucas will be on to talk about self-care, acupressure, and home care for in-between acupuncture treatments. And then on the 29th, we have Daniel Bernstein coming on to talk about insomnia and acupuncture. And then for episode 20, we are planning to do a patient testimonials episode, and we're going to, change things up a little bit for that episode. So if you are one of Dr. Rob's patients or one of my patients and you want to submit a testimonial, you can video record them. We're going to try and figure out a way to play those, or if you want to, we'll talk to Ming and see if there's a way to pop on, that people could pop on and make comments. But just to share some success stories, so it's not just, Rob and I just preaching to everyone about the success stories we have had. Sometimes people want to hear it from people who have gone through different things. Mm-hmm. I want to just thank everyone for listening. And to thank Ming for the use of his studio. Thank Rob for co-hosting with me.
Thank you.
And we will be back next week. Thanks so much, everybody.
The contents presented during the Practical Medicine podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented.
The podcast contains the opinions of Dr. Robert Balko, DAC, LAC, and Dr. Stephanie Lipnicki, DACM, LAC, and the guests of their show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition.
The views expressed in the Practical Medicine podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of action. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice.
Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us, thus all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.